computer. All right, so hi everybody. I have Matt with me from Team Iowa today, and he is coming to talk here in North Liberty at the end of the month, and I'm having a moment with the dates. So do you have
The
that?
25th.
25th. Okay, Tuesday the 25th at 7 p.m. And Team Iowa does great things over in Iowa City, and I've been over there for physical therapy myself. To work with Matt, and I'm so excited that he's agreeable to come chat with us. And so, with that said, I'm just going to turn it over to you, Matt. Tell us, what are you coming to talk about?
Yeah, so my background outside of just PT alone is strength and conditioning for the most part, and part of this kind of just passion project I've had since I got into the profession was trying to find a way to incorporate a little bit more of a classical strength and conditioning approach into physical therapy. And what that has kind of morphed into at this stage is what we categorize as the Team Iowa Performance Program. It is a kind of cash-based style approach to basically taking people beyond where rehab can get you. And a lot of times, the kind of the old school way of thinking about most rehabs is, you want to get that person back to that 80, that 90, that maybe 100% from prior to injury. What my goal is, especially with starting up this performance program, is to take that person and bring them above what their original baseline was that maybe predisposed them to that injury in the first place. So it's one of those things that works very nice for musculoskeletal conditions. I've had plenty of post-op patients that have gone through their rehab and then follow up with this after the fact. So the goal is really just to kind of bridge this gap that there seems to be, this wide gap between health and exercise and strength training with injury and prevention.
That's awesome. And I love the approach you take with that. And I think that different physical therapists, different exercise specialists take various approaches, which is good because what one person finds exciting may not be what the other person finds exciting. But what we all are coming together on and agreeing on is we need to bridge that gap, and what can that look like, and how can we promote that ongoing habit, right? And so I have more questions about bridging that gap. But first, what's
Mhm.
your why? So I feel like people who do what they do are good at it because there's a passion behind it. And so what's your why? I'm not sure I even know this answer.
Yeah, I think it comes from two areas. The first of which was, as I mentioned earlier, is my background. Like it was something that I was into far before I even considered being a physical therapist, and so that was always this innate drive that I had to, work out myself, but also help others. I was a personal trainer for a long time and a strength coach for a long time, and that kind of rolled into PT, which gave me that background of like, if I could do something that I enjoy and I can get other people to do it as well. That's big, obviously, from my side of things, but less selfishly, obviously, what we know from an exercise standpoint, especially now with the more current research, is that strength and conditioning, resistance training, whether that's any form of resistance training, is one of the best medications for the aging process. So it's something that isn't just bulletproofing you against injuries in the short term, but it's increasing bone density, increasing muscle mass, reducing fat mass, reducing issues with the heart, the lungs, respiration. I think that kind of stuff gets better with resistance training. And so it's something that I felt like was a good kind of way that we could elevate the current rehab profession and kind of take it to the next level.
Yeah, that's great. So that leads me to a question of resistance training, weights versus body weight. So I
Mhm.
teach yoga, so we do a lot of body weight with that. And for a while, I was really wanting to justify that as weights. I think there's a place for that, but I don't know the research in terms of comparison of body weight versus the resistance training. What can you tell us?
Yeah, yeah. I mean, traditional calisthenics approaches, so all body weight training, have their place for sure. I think the biggest dividing line that you're going to see, especially in most of the research now, is there is a certain threshold that our body has to meet, either from an external load standpoint or exertion standpoint, to actually hypertrophy muscle tissue. Body weight is good for most people, especially in those earlier phases where you're trying to learn the movement, get the movement patterns down. You can use things like, rep teams or hold times or tempo to kind of adapt that. But there is an upper limit on basically what we can get out of that style of training. And that's solely because eventually you need an external load factor to actually push yourself to that next level. And so the biggest thing is like all exercise is good exercise, right? But it is more specificity in terms of what we can get out of it. We don't see the same level of cross sectional area muscle growth or changes in bone density that we do between body weight and resistance training proper, especially higher load training. But you do see very, very similar trends in terms of fluid dynamics in the joints, joint health and integrity, mobility in the tissues, cardiovascular side of things. All stays about the same. So I think it's kind of a little bit of a goal focus. Um, I think everyone obviously would benefit from both styles of attacking it. But traditional resistance training, especially moderate to higher loads, is just gives us that extra little bit that we don't get with body weight training.
Yeah, that's perfect. And then also just to be clear, I mean, you said this, but just to reiterate, because I work with a lot of chronic pain patients, and I think that the reality of adding a huge load and resistance is very overwhelming to those patients. And so just know if you're in that category, make sure you're giving yourself credit for whatever exercise you are doing, and that's okay. So we're not saying that that should be discounted. This is just a discussion on the resistance training piece of that puzzle, but we could have a whole nother interview on the other pieces of the puzzle, right? But so you mentioned exertion with the various forms of light or heavy resistance. So what is like a an exertion level that we want to be working at to really make that difference? And in our world, I think we rate it like a ratings of perceived exertion scale. And if you want to kind of briefly describe that scale and what number we want to be hanging out at or a range.
Yeah, yeah. I think the tricky part with going into exercise and exertion is that every body is different, right? Every person's level of fitness is different. Every background in exercise is different. So those kind of scales, those 0 to 20 traditional scales, 0 to 10 is the one I typically use with patients. This is a little bit easier to kind of break apart those numbers. Is a good subjective report on where the person is during any exercise or movement pattern. The tricky part, and this is the part that I see all the time, especially on the people transitioning from rehab or just general, detraining into resistance training, is that idea of rating of perceived exertion is a little bit lower overall, in the idea that maybe they're 8 out of 10 is what I would categorize as a 4 out of 10. And a lot of that just comes from the psychology side of it. It's something that people, especially if they're recovering post injury, they are afraid to push into those higher levels. And if you combine that with, no real knowledge base of how to do it correctly, then it gets even scarier. That kind of ramps up that idea. And so you get these people that they find what they feel like is an 8 maybe the first time they do the movement, and then they just stay at that level, and they never actually make any gains out of what they're trying to accomplish, solely because they're not pushing their threshold a little bit. I think one of the biggest, most important factors, and this is one of the reasons why I helped develop this program, was because uh, you want to help boost the confidence in the person so that they can adapt to those new levels of rating perceived exertion and be able to feel confident in how they kind of push their exercise threshold going forward, because exercise is stress. It's literally designed to break down tissue so that we can build it back stronger. But there are certain criteria that we have to meet to kind of hit those levels where we're getting the benefits out of it.
Yeah, so you brought up an interesting point, and we cross this bridge with pain rating scales too. But if from the psychology standpoint of it all, let's say I'm exercising and I'm rating my perceived exertion on that 0 to 10 scale, 10 is super high. And I'm kind of hovering between that 6 to 8 and that's my perception in that moment. Is that something that you're going to strive for me to perceive that as a 6 to 8? Or where's your goal for that person to self-perceive, knowing that that scale is going to change most likely as they get more experienced and confident. But initially, where are you looking to have that person rate their exertion?
Yeah, and this is where the difference for me is taking off or putting on my rehab hat versus my strength and conditioning hat. And the idea that if we're looking at traditional models for strength and conditioning, to see baseline changes, that exertion level, that 6 to 8 range, is pretty critical overall for power development and the higher levels of strength, muscular hypertrophy. We want those 8 to 10 ranges for a lot of those movement patterns. That chasing of failure or close to failure shows the biggest benefits in terms of quality of muscle growth, cross sectional area growth, as well as just general strength. If I'm looking at it more from my rehab perspective, it's the same way as if I'm managing someone that maybe has, a white hot new injury. I'm not going to start them at that 6 to 8 range. I'm going to find that entry level kind of approachable zone of that 4 to 5, and we start there, and we get confident with the movement pattern. We get more experienced with a movement pattern. Then I creep up. We do that 6 range. We do that 8 range. My goal is by the end of that kind of progression series is to kind of build them on the similar movement pattern that they started with, and then just progress it to a point where they feel confident in that movement so much so that they can push into that 8 or more range for traditional strength.
Perfect. Yeah, that fear of movement initially and that catastrophization that comes with the especially post-injury kind of workout is very real, and there's a lot of psychology that goes into returning a person to be able to doing stuff um, like what we're talking about. So the two have to go together as you've explained. Um, so what do you think we've talked about all the great things that occur when people exercise and go on to this resistance training in terms of the physiology and the health benefits. But what are some of the reasons why people maybe don't take that jump to bridge the gap and continue exercising?
Yeah, I think a big component is kind of just complacency and comfort. It's, I don't want to have to work harder because I'm not in pain anymore. So why would I want to, have to do more overall? I think a lot of that stems from the idea that we are very much about rehab and not as much about prehab as we should be. In that idea that we wait until an injury occurs before we do anything about it. That is something that this profession is striving to change, obviously, especially just within the past 10 years. That idea that we can, work on things to stay healthier and not end up getting hurt is more important. And that complacency is hard to break for people, especially people that don't have a background in this kind of training, because they don't know what it actually takes to get there, and so their expectations might be that it's an insurmountable amount of work when you could find these very easy entry points for people that is something that they could do and still get the benefits out of.
Yeah, absolutely. Finding those easy entry points. That's a great phrase. I mean, right there, that says it. Yeah, that's tough. What about the fear of the perceived weight room culture? Um, I think that's a really real fear, and I don't know if that's more women versus men fear or men versus women fear. I could speculate, but I think that's real on both sides of both men and women can have that. Can you speak a little bit to that?
Yeah, I think that's something that people think about strength training, right? And you get this kind of stereotypical picture in your brain of, some big meathead dudes like throwing iron weights around, deadlifts and, pull ups and bench press and all that kind of stuff. And I think what people need to realize is that it is a huge spectrum, right? That is just one end of the old school strength and conditioning model. Now, especially now, we have so much more availability of different types of exercise that fall in that spectrum that are much more approachable. So more than anything, I think it's just, that that culture is definitely there in some gyms, some places, but it's something that people, I think, expect to see a lot more of than what it actually is in terms of it being present. That is also a reason that, with the performance programming side of things, a lot of times when people are going into, say, a new gym and they're worried about that kind of situation, that, I'm weak, or I don't know the movement patterns, or I'm going to look silly doing this in front of all these experienced lifters, just stems from the fact that they don't have any, actual hands-on experience in doing things right and know how to progress themselves. My goal is to expose them to that, to find the stuff that is doable, the stuff that they can do and take to wherever they're going to be working out, whether that's at home or whether that's out in a commercial gym, and be able to feel confident in the things that they're doing. So they're not as concerned about, oh, am I doing something silly?
Yeah, I mean, the culture and social media definitely feeds into the perceived weight room scariness. I will say that much. So, I give you permission to ignore social media if you're looking for that permission. But I think that there's a bigger lesson here that came out in your answer, and that's the lesson of confidence and self-talk. And we've talked about the great things that come physiologically with exercise, but let's go back to the psychology of our individual self, our mind and body. So, kind of me tying in a little yoga perception here. But, you know, if your self-talk is, I'm weak, I can't do this, I don't belong here, they're better than I am. And you can, through somebody like you, learn to be successful with an exercise program. How huge is that when you leave that weight room with the rest of your life? And I think, I talk about self-talk with people all the time, and in the negative pathways, the negative neurotransmitters, chemical messengers that get activated with our self-talk and our self-depreciation throughout our daily life. And I just, as you were talking, I was thinking, wow, that's just a huge, like, not even building muscle strength or bone strength, but what a huge gift that you give yourself when you go through the rest of your life.
Yeah, I mean it's something that you actually see kind of blossom in these people that have gone through the program on that side of it, because there's this innate fear right away of, am I going to be able to do this, or am I too weak, or am I going to not be able to work as hard as I should? And just to see that change occur where they get confident with a movement pattern, and then they can also build on that movement pattern, learn how to actually use progressive overload and push themselves forward. Honestly, just getting that little bit of confidence makes a world of difference, especially if they're entering, say, a new gym or a new what have you, because they have the tools that they need to kind of take care of themselves, be confident with the movements. And then I always tell everyone that goes through this program is that I am always here to fall back on. The goal is to make it an independent program for you.
Mhm.
But I want to be that source of information if you do need a change or a modification, or you have trouble completing a movement pattern, that you can circle back and we can kind of, navigate how to get you in the right spot where you need to be.
Yeah, awesome. So I know I was kind of floating some questions by you before we did this, and then I had to laugh because Matt decided to ask me a couple questions. I'm like, no, that's against the rules. I ask you the questions. But they were good questions. So and I know we're gonna wrap up here in a minute. But one of them that you mentioned was do you feel that the average PT is adequately trained for a performance-based approach, or do we need to do a better job as a profession? Um, and it's a good question. I think I would like to say that I wish that the average PT was adequately trained to understand all the principles, the big picture approach, but then be able to say, hey, I know this PT and this is what he does a lot of, and he's got a lot of extra training in that area, so I'm going to get you over to that PT, right? I think every PT should have that base knowledge of some high interval inter or some high intensity interval training, the benefits that can have, some overload based resistance, the principles of exercise. We all need to know that. And if we don't, let's get some continuing ed and be confident with that. But in terms of developing like a performance-based program, I think that's where we make use of people like you who have much more training in that area. It'd be like as a chronic pain specialist, myself, I run into this all the time. Lots of other PTs are treating pain and then they say, it doesn't work. And what they don't understand is that those of us who've gone through additional training have spent hours upon hours practicing those interview skills, learning the psychology behind it. We fine-tune that skill, and then it does work. And so same idea, it's nothing against other PTs who are trying to be the pain specialist. I'm thankful that everybody is trying. But in my situation, I think that if I have somebody that needs a strength-based, performance-based program, I'm going to send them on to somebody like you who has, that's what you do, right? That's your specialty. What do you think?
Yeah, I think as a whole, I mean, going through PT school in general, yeah, you get a great idea of what the basics are, right? What the concepts are, as you mentioned. The tricky part is that it doesn't make you a specialist in any one area, right? You kind of a master of all kind of thing. Um, the bigger thing is, looking into those people who have more experience in a certain area. Your chronic pain, for instance, is a great first step overall. What I feel like as a profession as a whole, that push towards us being a little bit more that hybrid of not just a rehab expert, but an exercise expert is just as important. And whether that's yoga like you, or strength and conditioning like me, but having that ability to take people beyond just rehab is super critical, especially just because people are trying to do more, be more active, be healthy, and if we can steer them in the right direction, that's something that's gonna get them there. That's awesome.
Yeah, that's so key. We should be exercise specialists. Every single one of us, no matter what, coming out of school, we should be exercise specialists. Totally. And more emphasis on that long-term health preventative stuff. Okay, with that being said, thank you so much. Come out and come have a discussion with Matt the last Tuesday of the month. And what's funny is Matt lives like a quarter mile from me, but we had to do this via Zoom because of schedules, Matt and his fiance. So thank you for doing this, and I look
Of
forward
course.
to chatting more with you. And so, who should come? Who should come to this talk?
Honestly, anybody. This is something that, like, if you have no training background at all and you're like, I'm kind of interested in the idea, awesome, show up. If you have zero interest in the idea, show up. I have seen so many different people for this program, whether that's young athletes that are looking for advanced plyometric training, jumping, sprinting, cutting. I've had, 75-year-olds coming off of total knee replacements that just want to take their fitness to the next level afterwards. So my goal is to make this approachable to everybody. So anybody is welcome.
Awesome. And when you come and talk, you're going to tell us like how to sign up for it if we're interested and taking that next step, right?
Yep, you got it. I will bring along plenty of information for that, and then we can ask as many questions as you like.
Okay, groovy. Well, thank you so much, Matt.